So I wanted to welcome all of you. Let me put this up here. Welcome. I wanted to thank you so much for coming out tonight as we talk about neuropathy. We are motivated to help you learn more about the conditions that might be impacting your life negatively. And in order for you and your loved ones to get the best from your life and achieve all of your goals and inspirations, I am Tiffany Roberts, for those of you that don't know me, with Back to Nature Lifestyle Medicine. My husband and I own a functional medicine clinic or alternative medicine, and we strive to help the community with education and to hopefully change our community to a more healthy community and eventually, hopefully, the rest of the world. So we do that one presentation at a time, one person at a time. If you have questions tonight, please let me know. I will try to respond to those as quickly as possible. If you have questions afterwards, you can always reach me at our clinic or our email. So let's talk about what neuropathy is. Neuropathy is a term that refers to malfunctions and general disease which occur within the nerves. As there are many nerves and nerve endings all over the body, neuropathy can be experienced in a huge variety of different locations and types of nerves. And the diagnosis and treatment will vary depending on where the location is. Neuropathy can also be classified according to the disease which is causing it, such as maybe you have neuropathy from the effects of arthritis, and this is called arthritic neuropathy. Many people are not aware of the debilitating effects that chronic pain like neuropathy can have until it becomes an issue for them personally or for a loved one. And defining which kind of neuropathy is being experienced and outlining a proper course of treatment will depend on what kind of nerves are impacted. You have motor nerves that are associated with movement of all of our muscles under conscious control, such as those when you're used when you walk or grasping things or even talking. And you have sensory nerves that transmit information about sensory experiences, such as feeling the light touch of someone else or pain resulting from a cut. And then you have autonomic nerves. And this regulates biological activities that people do not control consciously, such as your breathing, your heart rate, digesting food, gland functions, things like that. Some neuropathies may affect all three of these nerves. However, medical professionals will usually use the following terms to classify them depending on which kind of nerves are affected. Predominantly motor neuropathy, or predominantly sensory neuropathy, sensory motor neuropathy, and autonomic neuropathy. So neuropathy is most commonly known as peripheral neuropathy, which is actually the most widely experienced form of the disorder. Peripheral neuropathy is also referred to as peripheral neuritis and is experienced in the extremities, which is your hands and your feet, which are directly connected to the peripheral nervous system, the PNS. These include the hands, the toes, the feet, the fingers, skin, legs, and arms. A person suffering from peripheral neuropathy will experience discomfort in these areas, including varying intensities of pain, tingles, heightened sensitivities, numbness, and weakness. The peripheral nerves, which are found in these areas, extend directly from the peripheral nervous system and send information to the brain directly into the spinal cord. That is your central nervous system. The potential of peripheral neuropathy developing varies on which nerves of the areas that are damaged. So there's different causes. There's several different things which can cause peripheral neuropathy to develop, and these are usually, but not always, linked to existing illnesses. Peripheral neuropathy can result from traumatic injuries, infections, metabolic problems, inherited causes, and exposure to toxins. PN, peripheral neuropathy, is also been directly linked to higher levels of alcohol consumptions, cigarette smoking, and those over 40 years old. Because of the wide variety of causes and the huge amount of nerves within the body which can be affected by PN, it can be difficult to treat. Patients will respond to treatments differently, and some not at all. So, as with many other cases of chronic pain, functional medicine has an increasingly sought after route for patients of this disorder, as there are several different treatments that have been effective in relieving and suffering while getting to the root cause of it all. That's the key, is trying to find out why you have the neuropathy. Just understand that some of the functional medicine approaches to healing common forms of chronic pain, there's all different kinds that we can, if you have a good functional medicine practitioner, you're not just limited to one treatment for all, because each person got that neuropathy at a different pace, at a different level, different experiences. So we have to unravel what the cause of your problem really is. So there's different things that can cause it. There's another very common form of neuropathy, is the kind in which is induced by chemotherapy. Over the course of treatment, many cancer patients will develop symptoms of neuropathy in direct response to drugs administered during chemotherapy, such as vinca alkaloids, cisplatin, and I don't even know how to say it, paclitaxel. Certain types of chemotherapy affect the small sensory nerves that connect the spinal cord to muscles of the feet and the hands, causing symptoms such as numbness and tingling and pain in fingers and toes. Treatment with chemotherapy can also result in weakness, muscle cramps, and muscle fatigue. This results in an even tougher and extended recovery period for those enduring chemotherapy, and the severity of neuropathy experience will continue to increase as the treatment progresses. Likely, it has usually been noted to cease once the full treatment has finished, which is a good thing. Due to the high level of medical substances already within the body during that course of chemotherapy, it is definitely preferable to limit any excess intake of medication where it is avoidable. You don't want to overload the system already. It can sometimes lead to dose modification, which can then have a knockoff effect and it kind of impacts the chemotherapy success. So therefore, natural approaches to easing neuropathy are favorable, such as increasing exercise if you can, ingesting more key vitamins and minerals because you're getting wiped out, and trying herbal supplements and treatments that we'll discuss in relation to general neuropathy shortly. So there's also diabetic-induced neuropathy. Did you know that the most common cause of neuropathy is diabetes? High blood glucose levels and levels of fats associated with diabetes can impact nerve function over time, and symptoms can vary depending on which area of the body this manifests. Many diabetics experience either muscle pain or nerve pain, And it's important to differentiate between the two before diagnosing neuropathy. Around 60 to 70% of all diabetics will experience some form of neuropathy. About 1/3 to maybe half of those will experience this peripheral neuropathy. The good news is that it can be treated and eased by regulating blood sugars. The importance of this lies in the heart of diabetes as a whole. Returning the blood sugars to a healthy level and keeping them there is a key to minimizing the discomfort experienced by neuropathy. Making sure to become literate in the form of neuropathy, which is presenting itself to you, is the first step in conquering it. And as diabetes will also require some steady awareness and maintenance, and it can seem overwhelming, at times. So learn as much as you can about the particular imbalance in order to increase the chances of overcoming the discomfort of neuropathy that it can cause. And if you don't have a functional medicine practitioner, find one that will work with your lifestyle and your diet, along with supplements that can help with regulating diabetes. So it doesn't have to involve more toxins, okay? Functional health helps us understand how to ensure we don't have to take in any more toxins to the body than we already have. Limit processed and inflammatory foods, that's number one. This is a safeguard, a way to ensure your levels of inflammation are at their lowest. Test yourself on food sensitivities. If you do have food sensitivities, let us know, and we have a wonderful lab test that we can find out what your body is sensitive to. Take note of food timing. Part of regulating diabetic blood sugar spikes and lows is by ensuring your food intake on a regular, balanced patterns. This will not only improve overall symptoms of diabetes, but it will relieve pain associated with neuropathy as well. And making sure that you're eating quality food, not carbohydrates. So exercise, as this is great for increasing insulin receptor sites and their sensitivity. Exercise helps to regulate the body's processes, including blood sugars and hormone releases. Therefore, we have a great way to improve your function right at your own fingertips. And this is free and accessible to all of us, no matter how severe your symptoms may be. Exercise also reduces stress, and stress decreases insulin receptor sites and their sensitivity, which in turn lowers blood sugar levels and helps us regulate this the discomfort experience in the nerve endings. So it's all interconnected. So insulin is one of the only hormones that can actually control. So you can't really control your testosterone and your estrogen. You can supplement with that, but the insulin is the only thing that you can really control by making it hugely influential in our levels of health and imbalance and disease. The food that we eat is ultimately the area which impacts insulin the most. And so it's vital that we gain an understanding of our levels and our requirements before embarking on a course of treatment. Whether you suffer from diabetes or not, insulin is a key factor in your overall functionality and health, and it regulates blood sugars and governs the ability to absorb and regulate nutrients, specifically glucose in the body, and this actually helps with energy. So some foods that are good to consume and are helpful in regulating insulin levels include high fiber foods like whole grains and vegetables and beans, but you want to make sure that they're organic, okay? Protein-rich foods and snacks, healthy fats, can't get enough healthy fats, okay? And regulated meals, meaning you want to make sure that you eat just a portion. You don't want to have a huge heaping plate. I know we're getting ready for Thanksgiving, but on a normal basis, you want to have a controlled meal. You don't want to just overeat. Let's see, what else do we have? Nutrients that fight neuropathy. As functional medicine deals with natural methods, we can also prevent the onset of worsening of conditions. It follows that natural nutritional habits, sorry guys, and the foods we eat play a very large role in the part of our treatment plan. Some nutrients are better than others for specific reasons. For instance, potassium and magnesium. These two nutrients are essential for proper nerve function, as nerves transmit messages using the energy generated by potassium using the method called sodium-potassium pump. Magnesium calms overactive nerves by helping to calm and relax the nervous system and your muscles. This relaxation helps both nerves and muscles to regain mobility and reduce pain. Low levels of those nutrients might result in fatigue and cramping, weaknesses, and exaggerated symptoms. Potassium and magnesium-rich foods include bananas, sweet potatoes, squash, beans, avocados, and spinach. I don't do a whole lot of bananas. Once in a great while we will, just because they do have a high sugar content. So if you're doing like a smoothie or a shake, I always put in avocado because you always want to grab that banana for the creaminess of your shakes, but the avocado actually adds in really good fat and provides that good creaminess as well. Okay, increasing natural acids. So having studied the nerve body blood flow and the physical symptoms such as numbness and coldness, a scholar named Kathleen Head released statistics in the Alternative Medicine Review, which asserts that supplementing essential acids called ALA, alpha lipoic acid, and gamma linolenic acid, GLA, and omega-3 fatty acids may have a positive effect in treatments for diabetic peripheral neuropathy. ALA protects microcirculation and the peripheral nerves. Over the course of a long-term treatment that spanned months, several months, some trial participants experienced a reduction in symptoms and a better blood flow. ALC, L-carnitine, okay? Similarly, a naturally occurring amino acid called L-carnitine has been known to benefit neuropathy as it contributes to the regrowth and the strengthening of nerves and surrounding cells. It has also been shown to influence neurotransmitters in the brain's, including the acetylcholine and the dopamine. This means it's also mood boosting as well. So that's a bonus on top of that. Food sensitivities. There are countless correlations between food we eat and the physical pains or imbalances we experience. In fact, it's possibly the single most important factor in our day-to-day lives that we start impacting immediately when we first start trying to treat neuropathy naturally. To clarify, there is a significant difference between food allergies and a food sensitivity. Allergies will be obvious and apparent, such as breaking out in hives immediately after consuming peanuts, for instance. Sensitivities are more subtle and take a little bit more trial and error and cultivation of awareness to identify, like kind of like a bad relationship. Most people will not be aware of the damage it's causing until they eliminate it from their lives. This is an increasing amount of evidence being gathered, which suggests that things such as inflammation, gut health, and autoimmune disorders are far more prominent as root causes in neuropathy cases than we previously initially thought. This knowledge gives holistic health practitioners the ability to begin implementing treatments which align with each individual patient and can eliminate the root causes instead of numbing the symptoms, in this case, the painful tingling which is experienced during a bout of neuropathy. So let's talk about vitamin B1. Did you know that B1 is one of the primary sources of fuel for our nervous and muscular systems? This critical vitamin has two important roles. One, it helps to convert carbohydrates into energy so the nervous system can actually use it. And number two, it helps the creation of ATP, which is the molecule used in every single cell in our body to transfer chemical energy between cells for metabolism. The biggest problem with B1 is that our systems have difficulty absorbing it when we consume it through food sources. Only in a small fraction does it make it in. For that reason, many functional medicine experts will suggest taking a daily vitamin, a B1 supplement, in addition to eating B1-rich foods. The top food sources for B1 would be sunflower seeds, navy beans, black beans, green peas, and lentils. Those are all my favorites. B12. This is another key B vitamin, which can help to heal damaged nerves, and it is crucial for healthy neuropathy preventing diet, and that's B12. Foods with B12 contribute to the repair and the maintenance of nerve cells, in particular the myelin sheath. That's very important. Foods that contain high levels of B12 include sardines, snapper, venison, salmon, lean beef tenderloins, lamb, scallops, shrimp, and halibut. It should be noted that B12 is only found in animal products. So those following a vegan or plant-based diet, you definitely need to supplement, okay? Nerve damage occurs when the myelin sheath that covers and protects nerves, much like a rubber encasing surrounding electrical wires, when this deteriorates. The nerves misfire, triggering all the other nerve cells, which in turn contribute to further excessive nerve activity. Valuable food sources of vitamin B include the whole grain cereals. Now I want to make sure that you're doing organic, non-GMO, protein-rich foods such as meat and poultry, fish, brewer's yeast, milk, eggs, legumes, potatoes, and peanuts. If you experience peripheral neuropathy, incorporate a variety of those B-rich vitamins, because that will definitely help. Herbal supplements. St. John's wort is a flowering herb that is native to Europe, but is also found in temperate locations such as Asia, Africa, North and South America. Traditionally, the herb was used by the Greeks to treat menstrual disorders, snake bites, and wound healing. A lot of other things too. St. John's wort is also a powerful natural antidepressant, which is highly effective in soothing nerve pain. Therefore, topical treatments of St. John's wort oil can be successful in relieving peripheral neuropathy when applied to the areas of pain. Whether by their neuroprotective agents action or indirectly by the antioxidant activity, major molecule components of St. John's wort benefit brain and nervous system health. For this reason, it's been known to be of benefit by treating various nerve-related disorders, as well as Alzheimer's, Parkinson's, and addiction, and memory impairment and brain injury. Its simple application and widespread availability makes it a very realistic and popular option for those seeking to treat neuropathy naturally at home. Antioxidants. Foods that are rich in antioxidants are highly beneficial in treating chronic pain as they combat atoms known as free radicals, which interact with cell tissues and cause nerve damage and deteriorate your cells. Free radicals that are synthesized from oxygen are especially difficult to remove, as they not only interact with your cell's tissues, but they create more radicals. Antioxidants are components that neutralize those free radicals. Thankfully, various superfoods contain high levels of antioxidants. These foods not only heal damaged nerves, but they also may help to reduce the risk of cancer and immune diseases, as well as slow effects of aging. Food that contain high levels of antioxidants include blueberries. Blueberries are one of the top antioxidants in the world. Raspberries, blackberries, tomatoes, broccoli, red grapes, garlic, spinach, carrots, pomegranates, and yes, dark chocolate and green tea. Those are my last two favorites. So cranial neuropathy, it is used to describe the form of neuropathy which occurs when the nerves of the brain are affected by the disease. It can be argued that all forms of neuropathy affect the brain, as it is a nerve center of the body. However, with cranial neuropathy, the difference is simply that the dominant symptoms of peripheral neuropathy and others are experienced solely in the cranial region, okay, your head area. Examples of this include Bell's palsy. This is a condition that affects the facial nerves. It can cause partial facial drooping and is often caused by a virus that causes swelling, which puts pressure on the facial nerve. It also only affects one side of the face. You have microvascular cranial nerve palsy. This affects the nerves of the eye, causing double vision and other problems with your eyesight. Third nerve palsy. This one can cause an eyelid to sag or droop, double vision, difficulty moving the eye, and the pupil that is much bigger than normal. These symptoms occur because of the muscles that move the eye that are affected. Other disorders affecting the brain, which is an aneurysm or brain tumor, may indirectly cause a third nerve palsy. Diabetes and migraines can also cause this reaction as well. A fourth nerve palsy is also called superior oblique palsy. This affects superior oblique muscle controlled by the fourth cranial nerve. This can cause the eye or eyes, depending on where it's at, to turn abnormally and sometimes makes you see double. So treatment for cranial neuropathy can prove difficult as the symptoms are much more internal than they are external. But diet and environmental changes can be helpful. However, lifestyle and treatment changes will vary depending on the patient and their age. So acupuncture. Traditionally, ancient Chinese acupuncture deals with balancing the flow of energy, or your qi, within the body. The practice of acupuncture is a natural treatment which has been known to help ease the symptoms of neuropathy. However, it only provides temporary relief from the symptoms and is not preferred long-term. because it's not really getting down to the cause of it. Western medicine sees acupuncture as a way to stimulate the nerve and the muscles within the body. It regulates blood flow and boosting the body's response to pain. The needles involved in acupuncture are inserted into the body's pressure points, which are closely linked to the nervous system. The endorphins released through this activity act as a painkiller for the body and change the body's response to that pain. This study found acupuncture to be successful in relieving symptoms of peripheral neuropathy and suggests that further studies should be carried out to further potential benefits. I know I've used acupuncture for a very long time myself personally. I've actually had 300 hours of acupuncture with the great Dr. Yenny. So it's amazing. Okay, alcoholic neuropathy, as the name suggests, alcoholic neuropathy develops in the body due to excess consumption of alcohol. It can be particularly poisonous to the nerves, and the areas that it affects are not specific. Okay, alcoholic neuropathy particularly exhibits the symptoms such as numbness and lack of feeling in the extremities, lack of sensation, muscle weakness, heightened sensitivity and pain, balance issues, and lack of coordination. So stop drinking. Treatments for alcoholic neuropathy include, firstly, detoxing the system from the alcohol. Any treatment methods which suggest otherwise will ultimately be less effective in a long term. Rebuild nutritional deficiencies. It's thought that a large root cause of alcohol neuropathy is the neglected to follow common healthy dietary practices, which is starting to follow a healthy, balanced diet. And that's key in treating this form of neuropathy naturally, because you're depleting a lot of your essential nutrients. So environmental neuropathy, as with many physical and mental illnesses, the importance of environment on establishing the state of health and homeostasis in the body is huge. In terms of physical toxins, it's been observed that contact with substances such as mercury, lead, arsenic, and thallium, they can cause neuropathy in those that are prolonged exposure to them, even children. Industrial toxins in the workplace is common cause for this form of neuropathy. Some organic solvents and insecticides can also cause this. Assessing the presence of toxins and harmful substances in the living or working environment and immediate contact with a patient can be a great way to expose the root causes of the neuropathy and help those seeking to treat to understand how best to do so. Usually symptoms can be reduced simply by removing the toxin from the immediate environment. Yet in cases of prolonged exposure, more isolated treatments will be necessary. So recreational drug use can cause this over time as well. And as such, ceasing the use of those can prove to be an effective way to soothe this form of neuropathy. An easy and natural way to soothe this kind of neuropathy is through using cool and hot soaks, depending on the symptoms, massage, elevation and lowering of the limbs, and exercises. We also are getting in a wonderful, easy to take supplement that is in a drink form that will help remove these heavy metals from anyone, from children as well. So if you suspect that your environment is causing heavy metals and you're having neuropathy, please contact our office because we have a great tool that can help with that. Arthritic neuropathy. So treating neuropathy, which arises as a result of severe arthritic symptoms, can be difficult, and as affected areas may also be suffering from joint pain and carpal tunnel syndrome. Arthritis is an autoimmune disorder that is characterized by pain, swelling, and stiffness in the joints. Any joint in the body may be affected, and depending on the severity of the case, can be isolated or widespread. A leading cause of arthritis is inflammation, and as such, those suffering from this disorder and form of neuropathy as a result of it will usually see improvements by following an anti-inflammatory diet. Other natural ways to treat these symptoms include regulating your blood sugar, avoiding alcohol and smoking, regular exercise, increase that B12 intake, even lavender, chamomile, primrose, and neroli essential oils, when they're applied to those affected areas, definitely help soothe the area. Okay, gluten. How many times do we talk to you guys about gluten? The correlations between gluten intolerance and neuropathy are interesting, as intolerance to gluten is typically understood as a chronic autoimmune and inflammatory disorder whereby the body is unable to process certain gluten-containing substances in our food. The inflammation caused by the failure to process these food can also have other side effects, such as the development of peripheral neuropathy in the extremities and also heightened sensitivities of various joints and other areas of the body. So consider the following locations of inflammation in the body and their corresponding health implications. So inflammation at the joints. This is responsible for stiffness and arthritis. Inflammation of lungs and nasal passages. These cause respiratory congestion, asthma, and chronic cough. Inflammation of the membranes of the brain can cause headache and migraine. Inflammation of the nervous system, which is neurological disorders like multiple sclerosis and epilepsy. Inflammation at the skin, which can cause hives and eczema and psoriasis. So we can see that gluten intolerant related neuropathy, like so many other physical illnesses, can be traced back to the inflammation as the root cause. So getting rid of gluten can definitely help improve the symptoms of neuropathy. As most common causes of neuropathy is diabetes, it makes sense that leading factor of development of the disease is sugar and the levels we consume and absorb into our bloodstream. You don't have to suffer from diabetes or for sugar to impact your chronic pain. In fact, neuropathy patients who present with pains as a result of other causes also respond very well to removing sugar from their diets. The good thing is that sugar reduction is a natural remedy and does not involve replacement or ingestion of alternative substances of into your body. So basically, just getting rid of your sugar can greatly impact you. So balance issues. 65% of people with neuropathy, peripheral neuropathy, experience balance issues, and over half of the 65% are elderly and will suffer from debilitating falls at some point in the future. Due to the loss of sensation and the numbness of the extremities, which accompanies most all forms of neuropathy, the brain does not receive the correct response to external stimuli, and as such can cause confusion and balance issues. Therefore, exercises focused on improving and strengthening balance can be useful in treating neuropathy. Many physical therapists will include a course of rehabilitation treatment for severe cases of neuropathy, which can help balance-focused exercises. So that type of thing can help with the balance until you can get your cause of the issue under control. Sound therapy. One alternative treatment, which is still being studied, is the use of sound therapy in those suffering with neuropathy. Sound healing, also known as vibrational medicine, is a form of audio treatment by which the patient is exposed to specific beats, notes, rhythms, or vibrations of the human voice, as well as other objects that resonate to go beyond relaxation and stimulating healing. These include instruments such as Tibetan singing bowls and tuning forks and other signal tuned instruments. Nerve regeneration sound healing is commonly understood name given to this natural treatment, as it is thought to stimulate the regrowth of damaged nerves. Pretty awesome. Traditional Chinese medicine. For centuries, people have been treating illnesses and imbalances such as peripheral neuropathy with plant-based compounds and knowledge of the naturally occurring herbs and other compounds. This calls into question the very nature of using pharmaceutical to cure illnesses. So when there are means out there that are naturally occurring and are usually a fraction of the price, why would you want to go with pharmaceutical? Cordialis yunhoso. This plant naturally occurs in China, Japan, and Siberia, and was originally used in the treatment for menstrual cramps, chest, and abdominal pains as well. The root of Cordialis plant is thought to be reduce inflammation in areas associated with neuropathy, and are also preferable course of treatment to medical drugs, as the body doesn't cultivate a tolerance to them over time. So you don't have to keep increasing your dose, and in fact, you might have to reduce your dose later on. Some other forms of traditional Chinese medicine has also been proven beneficially in soothing neuropathy. So there's lots of herbs out there that we can also use to treat neuropathy. So we're almost done, but it's just the beginning of your functional health journey. So I hope that you have gained some valuable insights in today's class, and maybe even more inspiration to take holistic health route to treat your neuropathy. So before we end, I wanted to see if there was any questions before I dismiss class.